name is Rebecca. I'm going to give this just a minute to see if we have some people join us. I'll probably give it like 2 minutes and then we'll get started. If you guys can't hear me very well, or if the lighting's weird or anything like that, just comment so that I can adjust anything I need to adjust. Hi, Haley. Hi, Emma. I'm sitting on a birth ball, a yoga ball, so you guys might see me kind of rock and sway. I'm going to try to not do that, but it's kind of natural. Okay, so I think I'm going to go ahead and get started, and hopefully more people join us or watch later. My name is Rebecca Konecek, and I am a doula, and this is Conversations with the Doula. I work for Shawnee Health Service as a community-based doula in our Healthy Families Illinois program. Healthy Families is a home visiting program, and I've been home visiting since 2014, so about 6 years now. And then I started working for Shawnee in 2018, so it's been about 2 years, in their Healthy Families program. And I started off as a community-based doula, and so I became certified as a doula through DONA, which is Doulas of North America, and that happened last year. It's been actually just a little bit over a year now that I've been certified. And so I've been working as a doula for like 1.5 years, almost 2 years at this point. And I absolutely love it. I also love home visiting, and my job as a doula, as a community-based doula, sort of combines the two. So I'll start off by telling you guys a little bit about myself. I'm 28 years old. I have 2 beautiful little boys. They are 4.5 and 2.5. And then I'm currently pregnant with our 3rd, and I'm 32 weeks, and I am out of breath all of the time, so you guys might see me kind of get a little bit out of breath during this video, so I apologize. So we are not finding out what we're having with this 3rd baby. It's going to be a surprise, which is really exciting. We found out with our first 2 boys, and so I'm fully expecting this one to be a boy. But it'll be pleasantly surprised if it's a little girl. If anyone has any fun name suggestions, please put them in comments, because I am struggling with picking a girl name. I've gone back and forth a million times. So that's a little bit about me and who I am as a person. And then I fell in love with doula work. When I was pregnant with my first baby, I hired a doula, and I really just found a passion for it. It made a huge difference in my experience giving birth to my 2nd child, and I felt much more prepared, and I just felt like overall it was just a better experience. And so I really wanted to sort of learn that job and take it and give it back to the community and other people that I knew, because it really made such a big difference for me. And so I was super excited when I found this job with Shawnee to work as a community-based doula. And for those of you who don't know what a doula is, I kind of wanted to explain that a little bit. There's sort of two sides to a doula. There's the private practice world, and then there's community-based work. I do the community-based work, but private practice doulas are someone that you would hire to have with you during your labor and delivery. And they usually do a little bit of work prenatally with people. They usually meet you like 2 or 3 times before, and then they're there with you during your labor and delivery. They're kind of known for being pretty holistic in their approach and wanting to, you know, kind of give you the most natural experience that you can have. People tend to seek out private practice doulas to have that kind of experience. And so that's what I did with my second birth. But a community-based doula is someone who works for the community, and it's a free service for people that want to have a doula with them. They don't have to pay for it. And it's a grant-funded program, so that's what I work for. And so I still get paid, but I just am not paid by the family that I serve. So that's what I do through Healthy Families. So I enroll people into our program, typically in pregnancy. They have to live in one of our 4 counties that we serve, so Jackson, Williamson, Franklin, or Perry County. And so I meet with them and enroll them, and then if they're in pregnancy, and they're usually around like the 3rd trimester, so like 28 weeks, then I offer them doula services and kind of explain what that means. So we usually do home visits for about an hour a week as their pregnancy is coming to an end. It's weekly. Sometimes I start off doing like twice a month earlier on. And I just meet with you and I talk to you about what you want for your birth experience. You know, do you want it to be a natural experience where you don't have an epidural and everything is kind of as holistic as possible? Or are you wanting that epidural as soon as you get to the hospital as fast as possible? And that's different for everyone. There's no right way to go about it. There's no right way to give birth. It's just, you kind of have to roll with what happens. And so we talk about what you want to happen and what you think you want, and your wish is what I call it, like a birth wish. But we also talk about what might happen, what could come up, and what choices you have in those situations. So we work together as a team. I talk to you about the things that are available to you to have as options. And then we basically make a plan. I type it up and we go over it with your provider and make sure that they're on board for everything that we have sort of written out. And then I also talk to you about the fact that this might completely go out the window, and that's okay. And every birth is beautiful no matter what. And so that's kind of what I do prenatally with people. And then once they are in labor, they call me and I come to the hospital and support them during their birth. We try to offer continuous labor and delivery support. So there's a team of us to help sort of cover being on call, and like if someone's sick or something and can't be at a birth, to make sure that someone's there with you that you've met beforehand. So that's a really important aspect, I think, of the birth experience, is having someone there the whole time. Doulas are there to provide support for your partner as much as they are for you, whoever's there with you, your support team. We want to support them because they are there to support you, and they know you better than we're ever going to have time to get to know you. So it's a great, great tool to have people there to help support you with us. So right now, of course, with COVID-19, things are a little bit different. We cannot provide support at the hospital. SIH's policy right now is allowing one visitor to be with an OB patient. Typically people want that to be the father of their baby or their partner, maybe their mom or their sister. So we have not had any births in the last 2 months that we've been able to support in person. And if we do have a birth come up during this time frame, we are probably going to just offer to provide virtual support as best we can. And that virtual support might be for the birthing mom, or it could be for the partner or person that's there with them. So things are a little bit funky right now. And I'm sure a lot of you guys, you know, have questions about that and what that's looking like at the hospital. I'm definitely in the same boat. I'm due in July, and I'm not sure what to expect, if things are going to be better at that point or the same or possibly worse. I don't know. I'm kind of just trying to roll with it. But that's definitely a topic that I expect to come up over the weeks of us doing this. I kind of envisioned these conversations with the doula to be an actual conversation between me and somebody else, to be talking back and forth. but unfortunately right now I'm working from home and unable to sit with people and talk. But maybe long term that's something that we can look at doing if you guys were interested. But I really just want to make this whatever you guys want it to be. We can have conversations about labor and delivery and what to expect for preparing for that, answering any questions about things, you know, epidurals, inductions, policies at the hospital, things like that. You know, pregnancy related questions, postpartum questions for how you're doing in healing, what's normal and what's not, those kinds of things, preparing for postpartum stuff, or maybe like newborn care things, you know, things with babies and what to expect, or, you know, what to pack for your hospital bag, or what to pack in a diaper bag, parenting questions. I can go on and on. I'm certainly no expert, but I do have a lot of experience, and sometimes I try to shine some light on some different topics. Part of the home visiting world is that we are there to be a non-judgmental space to talk with people about what they're wanting to do, what they're thinking they want to try as a parent, what they've already tried, and what's working or not working. And, you know, I'm very much, I don't know those things a lot of times myself as a parent. And so, you know, you kind of have to have an unbiased source that you can talk those things out with, and then kind of make a decision and try and see how that goes. So I want to hear from you guys. Leave comments and tell me, you know, topics or things that you want to hear about in the coming weeks. And we'll try to do our best to get them out each Wednesday at 4. If people want maybe a different time or a different day of the week, please let us know that as well. We definitely want to try to accommodate people's schedules. So Wednesday at 4 kind of works for me because my husband gets home from work and can keep my kids busy for me so that they don't come running into this live feed. But we can also make other times work if we needed to. So I think that's everything. So I hope you guys enjoyed this. It's a little bit about who I am and the program that I work for. Yeah, I look forward to talking to you guys each Wednesday at 4 o'clock. Thank you.